Do you ever feel like your menstrual cycles are completely unpredictable or that your hormones are just broken? Maybe you've gone months without a period, or on the flip side, feel like you're bleeding nonstop. I get it. It's confusing, frustrating, and honestly exhausting. Today, we're going to break down what irregular cycles really mean in PCOS, uncover the hidden patterns your body is trying to show you, and explore practical ways to bring more rhythm back into your cycle so you can feel in control. Hi, I'm Mariah, and I've supported hundreds of women with PCOS, insulin resistance, and fertility challenges in taking back control of their cycles, balancing their hormones, and boosting their chances of conception. And this is all through natural methods and creating a lifestyle that truly works for them. Irregular cycles are one of the hallmark signs of PCOS. I see them as the body's way of waving a red flag, sending a clear signal that something deeper may be happening, whether it's insulin resistance, inflammation, or thyroid changes. Learning to read these clues is the first step toward balancing your hormones, ovulating more regularly, and for many women, improving fertility. So let's dive into the 5 most burning questions about irregular cycles and PCOS. So question number 1. Do irregular cycles mean my hormones are broken? And the answer is not at all. While your hormones may be imbalanced, irregular cycles are usually a sign that the communication between your brain and ovaries isn't working as smoothly as it should be. Many women with PCOS still ovulate, it just happens less predictably and less often. The key is to look for patterns, not perfection. For example, one of my clients, she was 25 and had been trying to conceive for nearly 2 years. She came to me with cycles all over the place. Sometimes her period would come just after 14 days. Other times, she'd be waiting over a month or more. Naturally, she started wondering if her body was broken. But when we looked deeper, we found insulin resistance at the root of that menstrual cycle chaos. Her fasting insulin was elevated, her testosterone was high, and her blood sugar markers were creeping into the pre-diabetic range. Once we focused on nutrition, targeted supplements, and some simple lifestyle shifts, her cycles started to settle down. And by month 5, she was ovulating more regularly, her energy was up, and she felt more in control of her hormones. And just a few months later, she got her first positive pregnancy test. So no, irregular cycles don't mean your hormones are broken. They're more like your body's way of waving a flag saying, hey, something needs your attention here. And that brings us to the next big question. What exactly is your body trying to flag? So let's dive into question 2. Could irregular cycles be a warning sign for something bigger? In many women, irregular periods are tied to deeper metabolic issues like insulin resistance or sometimes thyroid conditions. When cycles are irregular, it often means that ovulation isn't happening consistently, or in some cases, not at all. And when ovulation doesn't occur, your body misses out on the production of progesterone, which is crucial for balancing estrogen and keeping your cycles regular. Without enough progesterone, the uterine lining keeps building up under the influence of estrogen. If that lining isn't shed regularly through a period, it can become abnormally thick over time. This is why women with PCOS and long gaps between cycles may face a higher risk of endometrial hyperplasia, and in rare cases, endometrial cancer. It's your body's way of saying, we need to restore balance here, not just ignore these irregular periods. On top of that, irregular cycles are strongly linked to insulin resistance, which doesn't just affect fertility. It raises your risk of prediabetes, type 2 diabetes, fatty liver disease, and even cardiovascular disease if left unchecked. So irregular cycles aren't just an inconvenience or a fertility issue. They're a powerful monthly report card, showing you how your hormones, metabolism, and even long-term health are doing. Now the good news, once we identify and address what's driving the irregularity, whether that's balancing blood sugar, supporting thyroid health, or reducing inflammation, cycles often become more predictable. And with that, ovulation becomes more consistent, hormone balance improves, and the risks tied to skipped periods start to go down. But here's where it gets interesting. Even if your cycles aren't perfectly regular, your body can still surprise you. And this is what leads us to question number 3. Is it possible to ovulate without having a normal period? Absolutely. Ovulation can happen even if your cycle isn't exactly that regular 28 days in length. So just because your cycle isn't perfect doesn't mean your body isn't doing the work behind the scenes. One of my clients, who we will call RC, had this exact experience. She was 27 and had been trying to conceive for about 8 months and came to me after a miscarriage and years of irregular cycles, cystic acne, and even recurrent UTIs. So we focused on restoring balance in her hormones and metabolism, things like improving her blood sugar control, supporting her vaginal and urinary microbiome due to the common urinary tract infections she was getting, and we added targeted supplements like myo-inositol, N-acetylcysteine, and selenium. She also began tracking her basal body temperature and LH surges to better understand her own ovulation patterns. And here's where the story takes a twist. In June 2025, RC saw all the classic signs of ovulation. She had a strong positive LH test, ovulation pain, and then a clear temperature shift on her basal body temperature chart. Her fertility clinic told her she hadn't ovulated and then proceeded to cancel her IUI for that cycle. She was crushed and very confused. She had tracked all the signs. How could she have not ovulated? And yet, her body proved them all wrong. She actually did ovulate that cycle, and just a couple of weeks later, she got that positive pregnancy test. And here's the science behind it. Ovulation is triggered by a complex interplay of hormones, mainly follicular stimulating hormone, luteinizing hormone, and estrogen. And it doesn't always follow a strict 28-day timeline. Stress, insulin resistance, or thyroid changes, and even slight variations in hormone pulses can shift ovulation earlier or later than expected. And that's why a normal period length isn't the only indicator of ovulation, and why tracking signs like cervical mucus, luteinizing hormone surges, and basal body temperature often gives us a much more accurate picture. And this is such a powerful reminder that your body doesn't always fit into a clinic schedule or even a standard cycle. So paying attention to your own ovulation signs can give you the insight you need, and sometimes it's exactly what leads to that positive pregnancy test. And once you start paying attention to your body, it also helps answer another very common question. Why do some women skip periods for months while others seem to bleed all the time? It all comes down to which hormones are out of balance. In women with PCOS, high androgens like testosterone and insulin resistance can disrupt the signals between the brain and ovaries. This often delays ovulation or stops it altogether, which leads to missed periods. Essentially, your ovaries aren't releasing an egg, and without ovulation, there's no progesterone drop to trigger that period. Over time, this can affect fertility and even bone health because progesterone also helps maintain strong bones. On the other hand, some women experience frequent or extremely heavy bleeding. This usually happens when the uterine lining builds up under the influence of estrogen, but ovulation doesn't occur consistently. Without ovulation, there's little progesterone to counterbalance estrogen, so the lining becomes unstable and sheds irregularly. Over months or years, this unopposed estrogen can lead to endometrial hyperplasia, which is that thickening of the uterine lining, which in rare cases can then progress to endometrial cancer. And because iron is essential for producing healthy red blood cells and maintaining energy, thyroid dysfunction can also play a role. Other factors can also make heavy periods worse, such as low iron levels, for example. They can contribute to heavier bleeding and fatigue because iron is essential for producing healthy red blood cells and maintaining energy. On the other hand, thyroid dysfunction can also play a role. Both hypothyroidism and hyperthyroidism disrupt hormone signaling, impacting ovulation and the menstrual cycle. In fact, thyroid issues can make cycles shorter, longer, or more erratic, and may worsen heavy bleeding or prolonged bleeding. So when periods are skipped or heavy, it's rarely just one thing. It's usually a combination of hormonal imbalance, metabolic factors, and nutrient deficiencies like iron. Things like insulin resistance, chronic inflammation, low iron levels, or thyroid dysfunction can all play a huge role. Skipped cycles may point to ovulation delays, while heavy or frequent bleeding often signals unopposed estrogen and progesterone imbalance, sometimes compounded by low iron or thyroid issues. And both scenarios are extremely frustrating, but they're also powerful clues from your body about where you need support. So by addressing the root causes, balancing hormones, supporting thyroid health, correcting nutritional deficiencies, and improving metabolic function, it's often possible to restore regular cycles, protect long-term reproductive health, and even improve fertility. Which now leads to the fifth and final question for this episode. And this is what I hear all the time. Can lifestyle changes actually reset your cycle, or is medication the only option? The good news is that your lifestyle can be incredibly powerful when it comes to supporting your cycles. Small, consistent changes in nutrition, stress management, and exercise can have a big impact on hormone balance. Together, these strategies help your body find its rhythm again, improve ovulation and stabilize cycles, and even boost fertility. And it doesn't have to feel overwhelming or restrictive. Now, that said, sometimes medication is absolutely necessary and extremely helpful, particularly when there are risks to the uterine lining or when more intensive fertility support is needed. But it's rarely the only solution. For example, progesterone or progestin therapy is commonly prescribed for women with irregular or absent periods to help shed that uterine lining and prevent it from becoming too thick, a condition called endometrial hyperplasia, which can increase the risk of uterine cancer over time. In these cases, progesterone is usually given in a cyclical manner, meaning you take it for a specific number of days each month, often 10 to 14 days. And this is to mimic the natural rise in progesterone that normally occurs after ovulation. After finishing the course, a withdrawal bleed normally occurs, which is essentially a reset for your uterine lining. The duration of the progestin therapy can vary depending on your situation. Some women only need it short-term, while lifestyle or fertility interventions take effect, while others may need to use it intermittently over several months or years to protect uterine health. Importantly, progesterone therapy doesn't fix the underlying hormonal imbalance. It's mainly a protective and supportive measure for the uterine lining. And then there's letrozole or clomiphene, also known as Clomid. These medications are designed to stimulate ovulation for women who are struggling to conceive naturally. They're often used in fertility clinics as part of timed intercourse, IUIs, or IVF cycles. Essentially, they help your ovaries release an egg when your body might not be ovulating consistently or on its own. Most women take them for a short course at the beginning of their cycle, and ovulation usually occurs within a few days to a week after finishing the medication. And finally, there's metformin, a medication often prescribed for women with PCOS. It works by improving insulin sensitivity, which helps lower insulin and blood sugar levels. This in turn can support more regular menstrual cycles, improve ovulation rates, and even sometimes boost fertility. Many women notice gradual changes over a few months, and it tends to work best when paired with healthy nutrition, exercise, and other lifestyle strategies. And if you're curious about metformin and the natural alternatives you could try first, I cover everything you need to know in my YouTube video all about metformin, so don't forget to check it out. Even when medication is prescribed, it's usually most effective alongside lifestyle support. Things like balanced nutrition, stress management, and targeted supplements and exercise. Combining both approaches can often restore cycles more naturally, improve ovulation, and enhance overall health. So here's what you really need to know about irregular cycles in PCOS. They're not just random chaos. They're your body's way of sending signals. Each skipped period, heavy bleed, or unpredictable cycle is telling you something about your hormones, metabolism, or overall health that needs to be checked. Often these signals point to deeper issues like insulin resistance, thyroid conditions, or nutritional deficiencies. But the good news is with the right support, whether that's through lifestyle changes, targeted supplements, or medical care, your body can start moving closer to balance. Ovulation can become more consistent, and fertility can improve. If this video helped clear up some of the confusion around irregular cycles, hit that like button so more women can find it and start understanding their bodies too. And don't forget to subscribe so you don't miss my upcoming videos on fertility, blood work, hormones, and PCOS-friendly nutrition.